Welcome to the Pain-Free Movement. This channel is for those affected, frustrated or annoyed by musculoskeletal pain. Pain from injury, pain in joints or muscles, pain in backs and necks. This program has one simple goal: to help you sort out your problems. What is the single most important thing? I'm Max Kavanagh, a physiotherapist in Adelaide, South Australia. It's a world of confusing messages out there, and the single most important thing is your health. This program will address all aspects of healthy, pain-free movement, but with one goal: making it simple. We've all had injuries, some minor, some significant. Our body has fantastic abilities to heal, and it does this by itself. We don't have to think about it. But it is a process that doesn't always bring us back to what we would call normal. And it is a process we can affect. We can help it, or we can hinder it. If we want the best outcome, it is in our best interest to know what we should or shouldn't do. So, what is the single most important thing we need to know about our tissue healing process? Knowing about it helps us make the right decisions to help ourselves. The inflammatory process is triggered in our bodies when tissue damage occurs or when our body gets an infection. As our goal here is to help us deal with musculoskeletal injury and pain, we will focus on the damaging results from injuries. It is generally described as having 4 phases: bleeding, inflammation, proliferation, and remodeling. Bleeding is when damage to our blood vessels releases blood into the surrounding tissues. That's what bruising is if it comes close enough to the surface to see it. The inflammation stage we can think of as swelling. The inflammatory response is amazing. Our system reacts to the damage by sending an army of healing cells and chemicals we need to help us heal. Now, these 2 phases add up to the volume of swelling we get. The 5 signs of this stage are redness, heat, swelling, pain, and loss of function. The proliferation stage is healing. Once the damage to the tissue is controlled, the body can start healing. Our wounds can start to rebuild with scarring and tissue regrowth. And lastly, the remodeling stage is our recovery, when tissues get back their mobility and strength and we function normally. So, let's put all this into simple terms and consider an example of healing to help us understand what it is imperative for us to do. Let's pick something most of us can relate to: an ankle sprain. As we discussed last week, if we twist our foot inwards quickly and we tread on a pothole, the speed and force pushes past the ligament's capacity and we tear the fibres. We sprain our ankle. The small blood vessels tear and bleeding occurs locally. If it's bad, then the ankle starts to swell quickly. The damage caused kicks off the second phase of the process, and we get the tissue swelling from the fluids released into the tissues. It's a natural and necessary process. Swelling has the chemicals and the cells needed for us. The time it will take our tissues to heal is related to both the degree of damage but also the amount of swelling we have. So we need swelling, but we don't want too much. The more swelling we have, the more the body has to deal with. The more pressure from the volume of fluid, the more sensitive the area becomes. Now let me share my experience here. Being a sportsman in my earlier life, I witnessed and had many injuries myself. RICE, or RICE as it became known, came into our sporting world introduced by Dr. Gabe Merkin in 1978. It was a new way of dealing with injuries than was the accepted norm until then. Let's explain RICE concisely. R stands for rest, meaning stop the aggravating activities. I stands for ice, meaning apply ice packs initially. C means compress the area if possible, and E is for elevating above the heart if you can. And later it became RICE when a referral was tacked on the end, meaning referral to a health professional for significant injuries. And we try not to worsen the injury with harm, HARM. Avoid heating the area initially, alcohol, running or pushing on when injured, and deep massage. Now, I actually lived through the changes that occurred with the introduction of RICE. In my youth, it was common practice to be told to run it out. I spent many hours with infrared lamps and hot packs. Injuries took a long time to get over. A perfect example is the thigh hematoma, or corky as we call it. Time out for a thigh hematoma or thigh bruising back then was 6 weeks or even longer. I vividly remember my first exposure to the senior training rooms. I was in awe as I stood in the small medical room watching our big ruckman writhing in pain as our trainer worked feverishly with deep massage techniques to break up the corky and then applied the heat lamp. Nowadays, with rice, it's rare to see someone not return in a week or two. With the improvements in dealing with injury, time out dramatically dropped. So it's clear we are doing much, much better than we used to in dealing with our injuries with the rice management. Of recent times, there's been much discussion about how best to help our body. To be more specific, some have replaced the rest with POL, meaning protect and offload. So with the ICE acronym, it became police. Now a couple more acronyms are being discussed. Peace and love. Peace representing protection, elevation, avoiding anti-inflammatories, compression and education. Followed by love, load, optimism, vascularisation and exercise. How confusing is all of that? And if we're confused, we'll probably do nothing. Yes, we need to know more, but time and research will continue to help us to understand which of these things are most important and how and when to use them, and perhaps even for which types of injury we get. I think it's really important we don't throw out the baby with the bathwater and drop any of the rice principles yet. Sports Medicine Australia still advise the RICE basics, as do other sporting bodies and first aid programs around the world. True to our goal, let's keep it simple. To illustrate my crucial message for you all today, let's go back to an injury, but this time consider what happens when we slip with a cutting knife and slice our hand. As with the body's response we've discussed, we'll start to bleed and kick into the tissue healing cycle, and we know the injury will have swelling, scar as it heals, and the pain will diminish as we recover gradually. But what will happen if we don't stop damaging our cut hand? What will happen if we keep using the hand, or stretching the tissues, or put it into hot water? The aggravation will increase the severity of the injury. We'll have more swelling, more pain, and delay the healing process. What we know our cut hand actually needs is to do less with it. We can lessen the inflammation by compressing and elevating the area. We can support it so that it won't stretch open. It seems pretty obvious that will all speed the recovery, right? Remember, the body only has one process for our injuries. When we suffer an injury inside our body, we don't see it like we do a cut. But all injuries behave in the same way and need to be treated in a similar way. So, what is most important for us to do? We need to start treating early as possible to limit the excess swelling. The inflammatory process doesn't have a cap on it, and if we do the wrong things, we will get too much swelling. More swelling means longer injury. The principles of the RICE regime have worked well for us. Firstly, stop aggravating the injury. We need to stop damaging the tissues further. That might seem straightforward, just stop walking on the ankle. But what if it's back pain, or referred pain, or recurring pain? It might not be as easy to work out the things that are contributing to it. We need to know what is loading the injured area before we can address it. This is where expert advice may be needed. And secondly, we need to assist our body as much as we can in each of the tissue healing phases. So I believe initial icing is important. It won't stop all the swelling, and we don't want it to, as mentioned, but reducing the temperature of the body part is aimed at helping keep it from being excessive. I explain it this way. Back in chemistry class, we learnt increasing temperature increases the rate of reaction, decreasing temperature decreases the rate of reaction. So we do want to ice our injuries early, but not ongoing. And when we can, we elevate and compress the area to keep gentle movement as well. If we can lessen the early part of the first and second phases, it will result in less time overall, fewer complications, and less loss of strength and mobility. Of course, this makes sense when we suffer an accident or an acute injury, but what if we've had our problem for a while or it's recurring? Should you ice, or have you missed the boat? I use this 3-point simple guide to help clarify, to help decide where to start. If your problem is not getting better, you have an ache at rest, or you have significant pain in the night or during the morning, then your injury is likely to be still in the early inflammatory stage. Therefore, icing is better than heating. Heat may give temporary pain relief, but that's not the main game here. So for your task this week, if you have an injury or a persisting problem, I want you to go back to trying the initial process. If you fit any of those criteria, you can be the judge. If you're not getting better, you've got nothing to lose. And if you are going to do it, make sure you do it effectively. You need a large ice pack from the freezer. Make sure it's malleable so it won't give a skin reaction. You can crush up ice, of course, but that can get a bit messy. Wrap it in a pillowcase or a tea towel and then moisten the surface that touches your skin. Makes it really cold to apply, but that's the key point. Wrap it all around the body part and hold it in place with a towel or bandage. Time yourself for 10 to 15 minutes. Then pop it back in the freezer and repeat the process every 2 to 3 hours if you can. Now, we're not all professional sports people and we have other commitments, but if you can repeat the application at least 3 times a day for 2 to 3 days, you'll gain the benefit. If you can do 4 or 5, even better. In your journal, you can record how many applications you've done and the pain ratings. Once those 3 criteria are turning around, you can stop the icing and usually swap to heat. So what is the single most important thing about our healing process? The single most important thing we need to do to help us recover quickly is treat your injury early with the RICA regime. The longer we take to act, the longer we will take to recover. Follow the RICA protocol: rest, ice, compression, elevation and referral. We see sports professionals starting treatment immediately, and yet most of us don't do that. We tell ourselves, it's not that bad, I'll see how it is in the morning. Listen to your body. Treat your injury early with RICE. The sooner you start treatment, the less complex your problems will become, and your body will love you for it. It's in your best interest. And next week, we'll talk about helping our body to heal. If you found this video helpful, please give us a like, ding the notification bell, hit the subscribe button and join the pain-free movement. Because the single most important thing is your health. I'm Max Kavanagh, wishing you good health and pain-free movement, and I'll see you next week.